Hi loves, so I wanted to make a quick video. I wanted to answer the question from Cool Quality where she asked if she should mention in her interview that she's interested in going for the ICU. Now, from what I understand is that her interview is for a med surg position and she's gonna have a face-to-face interview and wants to know if she should mention it. So first I'll tell you what I would do, what I did, and then I'll tell you what you could do. So for my interview, when I met for the hospital positions, I was actually going out for a position for med surg, and I think it was a nighttime position. And during the interview questions, I mentioned to her that I did my capstone at this hospital in the ICU, that I've always been interested in the ICU, and that in 5 years I would see myself working in the ICU and eventually become a nurse practitioner and specializing in critical care. So I think that my answer were geared towards ICU so that she understood that I had a very strong interest in it, and that was my motivation. So I think that is something that you could say in the interview. Now, I don't want you to say that, I'm only really interested in the ICU and, med surg is just a way for me to get there. No, just say that, you are interested in it. This is where you planned on ending up because this is where your love has been. And I think that that alone could help you enough to get into the ICU, or at least put the bug in there. I would say another thing that you could do is say if you do not get the ICU position, hopefully you do, but say if you don't get the position, then I would say try to make friends with maybe some of the ICU nurses and see if you could shadow them or ask them for information when there are positions opening so that you can always apply to it. For my hospital, I know that you have to be within a certain position for 6 months before you can actually apply for another position. So if you do get into med surg, don't see that as a negative at all. See that as a way to get your foot in the door, to start to understand how to do IVs, to understand how to do a handoff report, how to take report, how to care for patients, see how rapid responses happen. You'll be able to see all of that in the med surg floor, and you'll get a good basic level. And better yet, you'll have nursing down. And I think that'll make it a little bit easier going into the ICU. Now, if you do get into the ICU from that interview position, then I say congratulations, that is a great thing. I was very happy when the position was offered to me because I didn't think it would be, because I was originally told that there was not a position in the ICU other than per diem. But I think mentioning it, or just saying that, if you can say this in the interview, if you happen to know if they have any available positions, if you wouldn't mind passing my name along to them as well, I would be really grateful. And then, they may send an email to you or not, or you can also find the the ICU nurse managers or assistant nurse managers email or contact information, and then also email them and say that I am interested in this position. Here's my resume, here's my background. I do have an interview within your hospital for a med surg position, but I would also like to be considered if you guys have anything, and just see where that takes you. Now, my absolute must for any interview is do a thank you note. I cannot tell you how vital that is. For me, I've always done it, and I feel that every time I've gone for any position, I've always gotten a job. And I'm not going to say it's because of the thank you note. I think it's a combination of things, but I think that the thank you note absolutely seals the deal. And I recently had a friend tell me that she was helping her friend get a job in her unit, and she hadn't heard from the job for a few days, and my friend asked her, did you send a thank you note? And the girl happened to say no, she didn't. And my friend was just like, what? Like, why not? You need to hurry up and send it. So she sent out the thank you note. She got a call later that day asking her if she wanted the position. So no matter what, send a thank you note, and then just do a quick thing like, hi, thank you much for your time. I really appreciate you meeting with me. I feel that I can really bring a lot of great qualities to your organization, and I would learn a lot from this organization. I'm looking to be a great team member and to grow within the organization for anything that may be open. And then say thank you, leave your contact information, and just say that I will be I look forward to hearing from you, and leave it at that. So I really hope that you get it. I wish you very good luck. Don't bring your phone in with you. Don't chew gum or anything like that. Try to sit up straight, smile. I wear a suit and a shirt, and I got commented that I look very professional. So definitely do that. Definitely ask interview questions. Definitely write down information and be engaged. And if you know one in the hospital, then I would say those are good references as well. So I wish you the best of luck. Hi loves. So I wanted to make a quick video to tell you guys how my first day in the ICU went, and it was absolutely amazing. So I'll just give you a whole breakdown of how it happened. So the night before, I actually had to work at my other job, so I left a little bit early so that I could prepare for the ICU. And what I did was is pretty much pack a bunch of snacks because I did not know what I was gonna need when I would have time to eat. So I just made myself a lunch. I packed everything in that. And then I went to bed probably around 10 something, and I woke up at 5. Now at the hospital, I need to be there at 6:45 in the morning, and it's about a 30-minute drive. So I wanted to make sure I gave myself enough time to shower, brush my teeth, and then eat something really quick and head out. So as soon as I got there, we're not able to clock in right away. You have to wait till a certain time. So I walked into the unit, and on my way walking into the unit, I actually saw my preceptor who saw me about, I think 2 weeks before that, and she remembered my name and said hi. We were talking as we walked in. She showed me where I could keep my stuff, and then I remembered I left my stethoscope in the car, so I had to run back to the car to get my stethoscope, and then I clocked in, and then I looked for my preceptor, and then pretty much got the day started. So the first thing I did was, once I got in, is so the first thing we did is we went and found the nurse. We found our assignment. And I had 2 patients with my preceptor, and we went and found the nurse that had the patients, and we got report. For me, I feel that report is probably the thing I'm having the most trouble with at the moment. They're telling me information, and I'm not sure where I'm putting it on my paper. I'm not sure what information is important. I'm not able to think ahead yet because I'm not sure, like, you know, there's information to tell me what it is that I need to do next. And I keep trying to tell myself, as well as my friends are telling myself, is to kind of slow down. Don't put too much pressure on myself. They know that I'm new. I don't have to know everything. Just take it as it comes, and make sure when it does come, you just understand it. So slow down. So I got report. Excuse me. So we got report, and then we go and we look at the patient. We assess the patient. We look at the lines, we see their Foley amount, we find out if there are any new orders put in, any consults that need to be done, anything like that. So then once we finished that with the nurse that was leaving, we started to look at the computer. We looked for any new labs, any orders, any of that stuff. And then we went in, we did a full assessment on the patient. And now my preceptor asked me that if I wanted to watch or if I wanted to actually, like, you know, do things. And I think that was a good thing for me because I know that I'm a hands-on learner and I like to get in right away. But some people like to observe. So I think that if you get into the ICU and you have a preceptor and you know that you're better at observing first and then doing, or doing and then observing, or whichever, I think that it's okay to mention that to your preceptor. So my preceptor did the first assessment on the patient, and I watched her do everything. And then I also listened as well. I felt for pulses. I looked at the lines. I asked questions, and then she documented. So then the next patient, I asked if I could do all that myself, and she said yeah. So that's how it went. So my preceptor was really great. I think it did help that I did have her previously last year. So I know as far as like you know, I know that when she talks, I know that I'm listening for certain things. I'm watching her do certain things. I think that it was a little bit easier for me because I wasn't as nervous, because it wasn't like I was meeting a brand new person. So she asked me if I would like to document. So then I began documenting. So I did assessment, I documented, and while I'm documenting, I'm asking questions. I'm asking her to check things before I submit anything to complete. I'm asking her to look over things, and I think that it's a good thing to do because they also mentioned to me that one thing that they worry about with is new graduates or just new nurses in the ICU is that they think they know everything, and that is an issue because then you can make mistakes because you think you know everything and you reality really don't, and you don't ask for help. Myself, I know I don't know anything about the ICU. I don't know anything about critical care. As much reading as I've been trying to do, I know that this is all theory and it's not practice. And you know, theory and real world are very different things. So while I was doing things, I was asking questions along the way. So we documented, did everything on that one patient. Then we went on to the next patient, did assessment, documented everything on that patient. And in between that time, I really didn't feel like there was any downtime. There was always something going on. I was either documenting, I was looking up for new labs for the patient, I was trying to make a handoff report sheet for myself that I felt that flowed a little bit better. We had to take one patient down for a study, and then, you know, during that time, there's like other things going on. Other nurses are getting admits, so then all the nurses or whoever's available goes in and helps that nurse get in their admit. And I could tell you that is definitely one thing that I love about the ICU. It was that it was a team feeling. That there's a lot of independent working, but when everyone needs each other, everyone kind of comes in. Nobody asks, what do you need me to do? They all kind of just fall in place and everybody just does it and helps everyone out. So I thought that was really great. When I was there, the nurses were extremely friendly, very nice. Everyone asked me if I needed any help, if I had any questions, and it felt really good for me as a learning experience, because I like to ask a lot of questions, and sometimes I do worry that I ask too many questions. And I mentioned that to one of the nurses, who was actually the charge nurse for the day, and she said that they love when we ask questions. She knows that we understand our limits, and that makes them feel more comfortable. So for the rest of the day, it was pretty much doing assessments, doing a ICU bundle, which is like mouth care, turning, assessing them, cleaning them, anything like that. We do all of that, and then we have to do an assessment for the Q4 bundle every 4 hours, and then you're also doing other assessments in between that. You're also doing positioning, you're assessing their pain, you're doing that a lot. So I felt like, to me, it was that once I got done with one patient, I went on the next patient, and once I finished that patient, I went back to the first patient. So it was a lot of back and forth, and then also helping other nurses or watching things as they're happening. We did get one rapid response that came in, and so I kind of helped a little bit with that. Like, we had to do like a MRSA swab to see, you know, if they need to be in isolation. They needed to get an IV in. I did ask the nurse if I could put an IV in, and that was probably a little too ambitious for me, because it was a critical patient and they like to make sure that they just get it in and, you know, get it in right away. But, you know, the response I got was, you know what, actually, because this is a critical patient, we're actually gonna let the resident do it. But, you know, if you want to try with another patient who's not critical, then that's fine. And I appreciated that, because I was just like, oh, you know what, that makes sense. I didn't think about that. I was just thinking so much of a learning aspect that I didn't think that, you know what, this is not the best situation. So don't get offended if anyone tells you that you can't do something, because honestly, they know better. They know best. So just follow suit and just figure out where you can better fit yourself in, or just ask them, where do you think I could be? So I would say that it was pretty much nonstop all the way until about 6 o'clock. I did get lunch like somewhere around 1, and I did snack a little bit in between, and I drank so much water. I was not expecting how much water, because I normally drink maybe about 40 ounces a day. That day I probably drank like 80 ounces. I just felt so thirsty, because I guess the constant up and down, moving back and forth, going to different floors and stuff like that. But it wasn't until about 6 something that things finally seemed to kind of slow down. I was able to write a little bit of a handoff report sheet. I actually took report too, which was very difficult, and I am very appreciative to the nurse who gave report. I did tell her I am orienting, so she said she'll give me way more information that she normally doesn't give. Even though she slowed down and she gave me a report, I still was all over the place. So I had my preceptor next to me, and I asked her, I was like, do you mind if I take report? And if at any point I feel like it's too much, or I feel like I'm missing something, do you mind taking over? She was like, sure, absolutely. So I took report all over the place. And then towards like the end of it, I was like, do you want to take this? And she was like, are you feeling overwhelmed? I was like, no, I just want to make sure that I'm not messing anything up for you. And she was like, don't worry about it. Take report. Anything we need, we can look up in the computer, or we can call the person back and ask questions. So that's what happened. So I finished the rest of the report, and then I asked her, my preceptor, I'm like, afterwards, I'm like, well, how did I do? She was like, you know, you still have to figure out what works for you. And as far as having a handoff report sheet, she was like, so it's going to be a little bit, it's going to be a little difficult for you to understand things and, you know, make and have everything flow. But she was like, that will take time, but other than that, you did well. So a little bit after that, I guess like around 6 something, it was probably like around 6:30, the night nurse was coming in, who actually is going to be my nurse preceptor for when I transition to nights, which is going to be at the end of this month. And it was nice meeting her, because now I get to have a face to who I'm going to be precepting with. And I asked her, I was like, do you mind if I give you a report on my 2 patients? And she was like, sure. And I was like, I'm very new to this. I was like, please give me any feedback. I just want to try to get it down pat. So I gave it, and I felt that I was, again, all over the place. And I think that I'm definitely gonna have to work on finding a good report sheet that works for me. So I think I'm gonna create one. And then I think I have to figure out what my flow is, because I would mention one thing and then I'd be like, oh, but then there's this, and then I go back to that, and then I'm like, oh, I'm missing this. So that is where I'm really gonna try to work on right now, is they said for each week you should have a goal. My goal is gonna be to understand a better handoff and make a better handoff sheet for myself. I think my also goal is to do a rapid response and to do CPR. I have my BLS and my CLS, my BLS and my ACLS, but I have never actually performed CPR on anyone. And that's something that I want to see, because in the ICU, you're part of the rapid response team. And I want to make sure that if I'm giving CPR, that I'm doing it adequately. I'm giving, you know, the right depth of pushes. I'm giving good CPR. So my preceptor said that, you know, once there is one, she'll let me know and she'll have me do the CPR so that she can gauge how well I'm doing and where I need to learn. And so after we did the report and everything like that, I asked her for anything, if she thinks that I need to do anything, and she asked me if she thinks that I need anything from her. And I said no. I was like, this has been a great thing. I feel very comfortable with you. I'm able to ask you questions, and I don't feel nervous doing things. I was like, but at the same time, I'm glad that I know that, you know, if I ask a question, you're right there, and you know, she asked. So, and she said that for me, that she felt that I did very well, that she liked that I was willing to, you know, start helping, start documenting and doing what I need to do. And that was a good thing. So that was my first day. And I can tell you at the end of it, I was pure exhausted, like mentally, physically tired. And it wasn't even that anything happened that was crazy. It was just like there's so much going on that I think I was trying to grasp everything at once. So I'm trying to tell myself to calm down and to just focus on one thing at a time. So right now I'm focusing on how to do handoff or making a report sheet. And then I'm also gonna look at like certain medications that they use frequently in the ICU. Focus on Diprivan, fentanyl, morphine, potassium, dextrose, insulin, all that stuff. I wanna understand, make sure that I understand everything down packed. What are their normal ranges? What are the contraindications? What are like some of the medicines that are, you know, that are not compatible? You know, if it could cause extravasation, where it should go. I'm just gonna look at that stuff and try to make sure that I understand that very well, because these are medications we're gonna encounter often. And then I think that will be the most I'm gonna focus on this week, is try to get that stuff down packed. And then next week I'll make a new goal. But yeah, I'm really excited. My first day went very well. I try to make sure that I'm sleeping well enough before going in and having work. So I will work again on Thursday and Friday, and then I have off the weekend, which will be nice, because then I'll be able to, you know, assess how those 2 days went and then see where I need to work on next to start improving. But if you guys have any questions, then just let me know and I'll do my best to answer them. Either I'll answer them in the comment section itself, or maybe if I'm making a new video, then I'll go ahead and answer it for the new video. Take care. Bye. Cool quality. Good luck on your new video. Let me know how it goes.